Welcome to the Heart of Giving. As you know, this is a wonderful program talking about the wonderful nonprofits we have in the city of Long Beach. All of these organizations are nonprofit, and what they do for our city is just wonderful. Today we have two more segments, and I know that you're going to enjoy meeting both of them. And the first one I'm starting with today is a group called the Tichenor Clinic. Now, if that sounds new to you or very familiar to you, we can tell how long you've lived in Long Beach, because the Tichenor Clinic has been going on for children for, well, I'll let them tell you how long. But today we have Lori Delaney, who is the executive director, and Sandy Mayuga, who's president of the board, both very well known in the community. And so, Sandy, I know that Sandy, Sandy, you have to wait. I'm going to talk to Lori first. Tell us what you do at the Tichenor Clinic.
Well, the mission of the clinic is to help provide rehabilitative services for children so we can maximize their functional abilities so they can fully participate in society. Physical. So we offer physical therapy, speech therapy, occupational therapy, orthopedic surgeons provide consults, and we have swim lessons.
And where are you located?
So we're located at 1660 Termino Avenue, right next to Community Hospital in Long Beach.
Very good. And how long has it been in our community?
Tichenor was founded in 1926, is the day they opened their doors. So Adelaide Tichenor was our founder, as you know.
Well, one of the things that I was going to point out is that Adelaide Tichenor was a woman in the community that was so far-sighted in the services that she started for children. I think she was part of the Long Beach State Nursery, and to think that Adelaide Tichenor has been here since 1926 is just phenomenal. And talk a little bit about the services you provide these children.
So there's 4 basic programs. The first is the orthopedic surgeons provide a clinic once a week. So it's meant for children who are underinsured or don't have insurance, or there's a gap in their coverage. We can get them in to see an orthopedic surgeon. We often help them get the coverage for Medi-Cal or one of the other insurances so that they can continue with their care. But when they need to be seen, we can take care of their back injury, their strain, their sports injury, whatever it is, when their feet turn in one more than the other, club feet. That's one program. The other program is all of the therapies. So we have physical therapy, occupational therapy, and speech therapy. And they work with the children, again, who have no coverage, their insurance, or there's a gap in their coverage, or maybe their visits are limited to 12 and they need more help.
What problems are that?
So the problems that they have, we see a lot of children who have weakness. They might have limitations in their joint range of motion, feeding problems. We're getting a lot of infants for prevention because that care has been, the funding has been lost for preventive care. And speech therapy, they work with children either who are delayed in talking or have problems producing the sounds, or some of the children are not able to talk at all and they use devices to help them communicate.
So you help children that are born with the needs that you provide, or have been in an accident, or in some way have lost capacity to function.
That's right.
So, and like, how many do you have?
So we had about 750 children come to the clinic last year.
Wow.
We provide 12,000 visits in the different programs that we offer. So it makes a huge difference to those families.
And I was going to talk a little bit about maybe if you have volunteers, but I'm going to go to Sandy because he's a volunteer, isn't he?
Yes.
He's president of the board, Sandy Mayuga. It's nice to see you, Sandy.
Pleasure seeing you again, Beverly.
You're a man about town. I see you a lot.
Well, I try my best.
That's great. Tell me what your capacity is.
I'm the president of the board of directors. I am in the middle of my 2-year term, and I was inspired to join the Tichenor Orthopedic Clinic when I learned more about the good work that it does. And you know, the institution has been around for 88 years. And I view my role as board president is to do my part for 2 years to ensure that it's around for another 88 years. And that involves motivating the board to help support the efforts of Lori and the rest of the staff at the Tichenor Orthopedic Clinic for Children.
And how have you kept it going? I mean, seems like such a big organization and so many wonderful things you do for children. It must be a strong board to keep this train on the track.
Well, over 88 years for any organization, whether it's a private business or a nonprofit, for anyone in these days to last 88 years, takes excellent management, it takes vision, it takes an understanding board of directors to guide it properly. And if you look back at the history of the Tichenor Orthopedic Clinic for Children, many of Long Beach's luminaries, the name of the past presidents and past members of the board of directors reads like a who's who of Long Beach leadership. And one of the reasons why I joined the board and am such an enthusiastic supporter is that it is very well run. It has a visionary support foundation that provides much of the funding, and it's been supported itself over the years by the broad range of members in the community, from businesses and foundations to members of the community, individual citizens, broadly supporting the foundation, which in turn provides support for us.
That's excellent. Well, I know that you've had some excellent boards, but you know, the need has been met as much as possible, because you get everybody. But it also has expanded, I think, in what you can do, because I think you haven't been working with children with speech problems until that's your newest program.
Yeah, that's one of the latest additions, and we're about to open a more intensive program for children who are nonverbal, who are using devices to communicate and technology and the iPads. So the capabilities there are just huge.
Tell me about your staff. How many people do you have on your staff, and do you have volunteers? Tell me about the people that are doing all these wonderful things.
We have wonderful staff. They're the people that make everything happen. So they're very well-trained professionals in each of their disciplines. We have 20 people on staff. They provide evidence-based practice, and so we have 4 physical therapists, 3 speech therapists, and the occupational therapists. They have specialties in their areas like feeding or hand therapy or
And volunteers? Do you have volunteers?
we have lots of volunteers, and they really help out with especially the early intervention program for the 1 to 3-year-olds. It's like a preschool setting for children with delays in more than one area. The volunteers come from actually Cal State University Long Beach. They're students who hope to become physical therapists, occupational therapists, or speech therapists, and parent volunteers. We have a huge parent support group now, and they are empowering each other and learning about all the resources in Long Beach that will help
them. And finding each other.
And finding each
with
other.
people that have children that have these needs.
So they know they're not alone. Yeah.
That's marvelous. Well, would you like to leave us your telephone number?
Yes, sure. Our number is 562-597-3696.
Well, these times go so fast, and there's so much to say because of the wonderful work you're doing. I wanted to talk about maybe some of the special needs that you're meeting and finding new things that need to be done. So, but I thank you very much for being with us today. Thanks a lot.
Thank you.
Thank you for the opportunity.
And see, I told you, another wonderful story about the things that are happening in Long Beach. Please stay tuned. We have another segment for you.